Hi, my name is Lisa Stone. I'm the bariatric coordinator at Stringfellow Memorial Hospital, and we're going to talk a little bit about the importance of support groups. Now, the presentation that we're fixing to talk about was actually developed by another bariatric coordinator at a different hospital, but the concepts of support groups apply throughout. Some of the reasons people do not attend support groups is things like their busy lives. Obviously, we all have them. So, between work, home, and social activities, a lot of times people think that their schedule is just too hectic to do support groups. However, it is important to make your health a priority. You've gone through the surgery, you're doing your diet, you're doing your exercise, but to be able to talk to somebody about doing the day-to-day activities for bariatrics is something that you can share with others and maybe pick up some insightful um, tips that you might be able to do along the way. Some other people, if you have walk-in groups or you have face-to-face groups, which right now I know a lot of people are still doing just the webinars as we are, but we are eventually hoping to get back to live support groups. But in that aspect, even listening to a webinar and stuff can feel a little bit intimidating because as you listen to people, you might realize, well, they've done this before. They're all friends. They know what's going on with each other. And I hate to just step into this role. Well, first step is walking through the door. And each time that you go to a group meeting or you listen to webinars, you learn a little bit more. You share what you have learned with others. And so that way, it works very well for both you and the other people in the support group as you learn to get the support that you need. I'm doing very well. I don't know that I really need support groups. That is actually one of the main things that we hear from people, and it's real easy when you're doing fine and your diet's going along fine, your exercise is going along fine, life is great, and you have very few bumps in the road. But when you hit those bumps, then you just need to know that you do have a support group there that can help and give you inspiration to continue. But just like starting a support group on your first day, it's easier if you've already built the camaraderie with the people to go in and be able to discuss what issues you have. Maybe it's even holidays coming up and you're not quite sure how you're going to do with the holidays coming up. Talk to some of the people in the support group. They can give you tried and true examples of what has worked for them. But that way, you're not going into your very first support group already having concerns about some of the things that might be coming up in your life, that type of thing. So if you start it from the beginning, then as you go on, you might even learn how to adapt to a situation beforehand because you've heard other people talk about it. So, like I said, make sure your support groups are a priority in your life and attend them anytime that you are able to. Relationships. One of the favorite things about support groups is the relationships that you build with others and people that have gone through the bariatric surgery and the bariatric program and have um, the same joys and frustrations and stuff that you have had on this journey um, for losing weight. And so that way, it just gives you somebody to talk to who has the same frame of reference that you do. Safety. The other thing is bariatric support groups are built around our bariatric patients. So when you're talking about things that you struggle with, weight loss, maybe a little bit of weight gain, the fact that your food choices may not be what they need to be, nor your supplements, or the exercising that you're doing is not quite right. This gives you somebody to share your struggles with and stuff, and it's in an enclosed environment, and nobody's going to judge you, and nobody is going to look at you like you're not doing what you're supposed to be doing. These are people that have gone through the same thing with you, so it's a safe place, it's a safe area to be discussing the concerns and stuff that you have with people who have faced the same challenges that you are currently going through. Or you can even talk about how well you have done so that way somebody else may be gleaning some information that you have passed on, that you have learned. So don't always feel like that you have to be the one receiving the education in the news. Maybe you have um, areas or ideas that have worked for you as far as diets or exercise or anything like that that you would like to share with the group. It is very much a back and forth and a sharing environment of what works for everybody. Education, as we all know, there's always educational groups out there for bariatrics. You can look up all sorts of things on the website for bariatrics as far as foods, vitamins, diet, exercise. You can Google bariatric care after surgery and stuff, and you will see all sorts of ways to recommendations and that type of thing. The support groups also do try to keep up with the latest and greatest when it comes to recommendations on food and nutrition and vitamins and that type of thing. The main thing about support groups is just to know that you are there for each other, and the best way to feel like you're not alone in this struggle is to join a support group. And right now for Stringfellow Hospital, we are doing webinars. They are February, April, June, August, October, and December. They're the fourth Tuesday of every month on those months. Right now for COVID, we're just doing the webinars, but we are hoping to be able to open up to have in-person support groups in the future. So just keep track of our webpage and keep listening to the webinars and joining in on the webinars, and hopefully we will get to see you soon in person. If you have any other questions or concerns on this topic or any other bariatric subject matters, you can contact myself, Lisa Stone, the bariatric coordinator, or Catherine Parker, our dietitian, or you can contact the Anniston General Surgery Group to talk to any of the physicians there, or Lauren. So if you have any questions or concerns, you can reach anybody on the screen. And you enjoy your day, and I hope you start attending our webinars. Thank you very much.